Good afternoon, my name is Josh Barrett. I'm one of the osteopaths at the Pura Vida Clinic. Today I want to talk a little bit about management for tennis elbow or lateral epicondylitis. Now with this condition, it's typically an overuse injury. It's not always, but it can be an overuse injury. And aggravating factors tend to be those repetitive tasks that we're doing on the day-to-day that we don't even notice. Now this might be something like typing away at your desk or riding your motorbike. Now in both of these positions, you'll notice that my arms are outstretched. With just the anatomy of these muscles, if you try gripping something, I've got some hand sanitizer here, so if you have your arms out in front of you, you try gripping as hard as you can, and then you compare that to flexing the elbow and bringing your wrist into a more neutral position and gripping it, you'll find that you're able to generate much more force in this position compared to that position. Now that's because of something that we call bone on tendon pressure or bone to tendon pressure. Essentially, when you're in this position, there's a little bit more compression going through the common extensor insertion, as it were, it attaches to the outside of the elbow, compared to this position. Now, this compression impacts the function of those tissues as a consequence, which is why you're able to generate more force here compared to here. So, if you're doing some repetitive tasks day in, day out in this position, whether it's further away from your body and your arms are outstretched, what we can do is adjust that. So just through being more mindful of it, trying to think about it, or adjust the setup you have at work, or on your motorbike, you can adjust sort of pedals or position. This can dramatically decrease the stress that you're putting on those tissues on a day-to-day basis, and that can sometimes just tilt the scales into your favor, in favor of recovery versus against it. So that's my top tip for today.